In this video, let's talk just a little bit about my thoughts on smoking and why I think patients should consider, if at all possible, to quit smoking, not only just for their general health, but also if they're considering surgery. Smoking has some effects on the body. In particular, it can affect the blood supply to the tissues, and it can also affect bone healing and bleeding. When a patient's preparing for surgery that is a smoker or has a history of smoking, their risk for surgery is higher. They have a higher risk for postoperative bleeding. They have a higher risk for the wound having issues. There's a higher risk for the bone if we're doing a fusion to not fuse. And so we do encourage the patients to quit smoking if at all possible. In some cases, we actually won't do the surgery if they do continue to smoke. And this would be more for an elective surgery like an elective lumbar fusion, for example. I think the risk with the smoking is too high to consider doing an elective lumbar fusion. This is not to be judgmental. We're not trying to criticize anybody that smokes or has other things that is associated with their lifestyle. It's just a risk analysis. And in the equation of surgery, if you will, we want to have the highest benefit possible with the lowest risk. And if there's something we can do to mitigate risk, we want to do it going into surgery. Complications in neurosurgery in particular can be very difficult for the patients. They're difficult for us. They're hard to deal with. And we want to avoid those complications as much as possible. So if you or a loved one are preparing for an elective surgery, and even if it's a surgery that's not elective, do everything you possibly can to quit smoking in the weeks and months before surgery, so that the body has a better ability to recover from the surgery and to lower the complication rate.